Next, I request Dr. Meenakshi to uh, give a talk on early identification of autism. I think this talk will be very, very crucial for all the general pediatricians, because it's our duty to pick these children at the early stage, identify them, and start the therapy at the earliest. Over to you, ma'am.
So, Madam talked to us about a lot of things that go in development, right? Growth and development. There is genes, there is interaction between genes and the environment of the child. By the way in which the child's behavior influences the environment, even the environment will influence the child. Thus, early symptoms of autism may reflect and contribute to abnormal trajectories of brain development. So, how do we understand all this? How have we, come to all these conclusions? So they've done a lot of retrospective studies. They've seen children who have already been autistic, and they have traced back and looked at their videos of how they were talking, about their social interactions. So one is retrospective. The other thing is prospective. So what have they done? They have followed up siblings who have had autism, because they are again at a high risk of autism, and then they see how the milestones develop in them, and combining these two methods provides the broadest picture of early development of autism. So as we all know, it's a triad. It's for social interaction, social communication, and repetitive behaviors. When there is a problem in these three, then we think of autism. But of all these three things, what do you think is the earliest to happen? Yeah. So it's basically when the baby is born. What is it that a mother thinks of? Will she be thinking about when is she going to start talking to me, walking to me, or she just wants to hold the baby, hug the baby. She wants to see her baby smile. When is my baby going to smile at me? When is my baby going to coo at me? When is my baby going to make sounds? So social interaction becomes one of the early things that we should look at. Of course, after that comes social communication, as what Sir told. We have the language development, speech development, and all that. But then this is the arena where we would like to identify our babies, because by the time they come and tell us at 2 years, 2.5 years, that my child is not speaking, he's just speaking only a word or two. We have, as we all know, early intervention is important in autism. So, that golden period is something which the first 2 years of life, okay, is important for us. So, this is the time we have to look at even social interaction. So, changes in social interaction or problems in that is what we have to identify earlier, okay. Then you have social communication and repetitive behaviors. So when do these symptoms actually manifest? So they're generally not present in the first 6 months of life. It's very difficult to identify. As I said, prospective studies have shown that they may manifest in the later half of the first year, which may just include delayed motor control, feeding difficulties, sleeping difficulties, excessive, either they feel that the child is very irritable child, or the child is a very quiet child, okay. And symptoms in the core domains of ASD usually emerge between 12 to 24 months. Initial presentations vary, but there is no single behavior sign that says that, okay, because this is there, this is ASD. Because this is not there, this is not ASD. There's no single behavior sign, okay? So, symptoms must be present in the early developmental period, but it may not become manifest at an earlier age. So, only when, the social demands exceed what the child can take, that time it may be manifest, okay? And symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. Okay, so this is what I said, social interaction, social interaction. So, even, when we show a newborn baby, to their siblings, they just look at them. They feel like it's just like a doll, right? So, only when the baby starts growing, they realize, oh my God, now I have somebody to play with. to talk with, who's going to respond back to me. Okay, so that is the picture of the baby when it's born, and this is what every mother, really waits to look at. So in infants at risk, okay, so I'm going to talk about, concentrate mainly on the first year of life and second year of life. So in the first year of life, they have the babies at risk have lower levels of orientation to social stimuli such as faces or voices, poorer imitation, poor eye contact, lack of social interest, less social smiling and reduced expression of positive emotion. And these will diminish their opportunity to learn about or interact with people around them. And this, as we all know, can cause concern to both parents and practitioners. The next is communication. So many typically developing children produce a few words by the end of 1 year. But in this 1 year of life, it's not just one, as we do in our exam, at the end of 1 year, one word. That is not the gold standard or something like that. There are other forms of communication. Okay, retrospective studies have seen that infants who go on to develop ASD may exhibit delays in sound production, vocal quality. They produce less simple and complex babbling at 12 months. And this early disruptions may also be seen in both the production of and response to communicative gestures. Okay, so we have what is called communicative gazing, pointing, joint attention. All this develops in the first year of life. So so how does a baby communicate? A lot of parents are distressed when the baby is born. The baby is crying, something is wrong. Crying doesn't mean my baby is always, there is some pain or something like that. It's a form of communication. Okay, so that is how the baby communicates. Then 1 to 3 months, they start cooing, like ooh, ah. So basically cooing is they laugh, okay, and they vocalize in response to speech. Okay, so cooing is basically has more of that vowel component in it. Then 4 to 6 months, you have the consonants that start coming, b, g, okay. And then 6 to 8 months, you have the bisyllables. They're able to imitate the sounds, and 8 to 12 months, they have multiple syllable types. And babbling is produced with a sentence like intonation, okay. So just your kind attention now, okay. So what is this joint attention? So joint attention is something that, see now the mother is saying, look, and she points, she's asking her child to look at the toy, okay. So what is the second stage, what does the child do? The child looks at the toy, and then she looks back at the mother to say, what is she going to say next? So it is a shifting between the toy and the mother. So this is the joint attention, okay. This is, there are stages in which this joint attention develops. In the first 2 to 3 months, the infant smiles in response to parents' smile. In 8 months, they're able to follow the parents' gaze. At 10 to 12 months, they're able to follow a point and look back. This is where the joint attention actually starts happening, okay. Yeah, and this is the pointing what we, keep asking sometimes. So there are two types of pointing. One is proto-imperative pointing. Now, if I want a chocolate, I will ask, I want this chocolate, okay. The other thing is a proto-declarative pointing. So proto-imperative pointing usually develops at 1 year of age. Whereas proto-declarative pointing is something you see something really beautiful, okay, something really very interesting, you say, hey, look at that. Okay, then the child and the mother, or the child and the caretaker, they look at it in awe. Okay, so that is proto-declarative pointing. Okay, so this develops at around 18 months of age. Okay, so in children with autism, they can have problem with both imperative pointing and declarative pointing. They may not be able to point out also. They may, if their child wants something, she may just take her mother to that particular place and start crying there. Or sometimes they are able to point, they may have proto-imperative pointing, but most of them will not have this proto-declarative pointing, that the experience of sharing and sharing the joy and excitement, okay, that is impaired in these children, okay. Wow, so what is this? Who is suddenly why has this slide come here? Yeah? So this is proto-declarative pointing, okay? So obviously, I can't get Aishwarya Rai, neither can you get Aishwarya Rai, she belongs to Abhishek Bachchan. So there is no need based in this, it's just that you're enjoying it, that's all. Okay, so can you identify him? Okay, I think one more. He is the Pokemon creator. I had the cartoon with me that's not being played. Okay, he is basically, he was an autistic person. He used to love insects when he was small. Okay, and that is what, you know, made him create this Pokemon series. Okay, so, yeah. So the next thing what we talk about is repetitive behavior. So repetitive behavior is something that we commonly, is less commonly observed in the early stages of development. Usually as the child starts growing, this becomes more manifest. Okay, and but retrospective studies have shown that these babies, when they were small, in their infant stage, had increased object mouthing, unusual postures in their first year. And there was also a trend towards increased exploratory activities with objects between birth and 6 months. And also they had, some of them had more self-stimulatory behaviors. Okay, then other noted motor abnormalities include sometimes they may have decreased motility, abnormal muscle tone. Okay, so other domains may also be affected. So going on to say, sometimes these babies, you know, retrospectively when they analyze, they are very passive. They have been considered too good, or they may be too irritable. Okay, and they have also reported altered sensory responses with, they may be hyperreactive to sound, hyperreactive to visual stimuli. Okay, and these babies tend to be stickier. Okay, like, you know, they have sometimes abnormal prolonged fixation. Okay, so. And the other alteration what we can see is the head circumference. Sometimes it may be normal at birth, but at the age of 2 to 4 years, both the head circumference and volume sometimes are enlarged. Okay, so so although research has shown that signs of ASD are present during infancy, that is the first 1 year, it is noted that 1 out of 5 children with ASD appeared to display a normal developmental trajectory during the first 1 year. So it is important to bear that the absence of early risk markers does not rule out the later development of ASD symptoms. Okay. So now you go to at a nutshell, so these are the red flag signs between 6 to 12 months. Okay, reduced or a limited smile or joyful expressions, limited eye contact, limited reciprocal sharing of sounds, diminished or atypical or no babbling, gesturing. In 9 to 12 months, emerging repetitive behaviors, unusual play. Okay, now coming to toddlers. Okay, here there is a wealth of evidence. Okay, and it is partly because even the parents are able to recognize some changes or something different in them. Okay, and by 24 months, 90% of the parents recognize that the child's development is abnormal, and most families initially express their concern by 18 months of age. Okay, so if you look at this age group, it closely resembles what you see in an older child. So you have social impairments. Okay, for example, toddlers with ASD shows reduced attention to social stimuli such as faces, and they may show marked deficits in orienting to social stimuli that exceed those in orienting to non-social stimuli. They prefer more of these machine noise or something like that, or rather than, you know, human voice. And diagnostic symptoms found in older children like limited eye contact, limited overall social engagement responsivity, and increased tendency for isolation is also seen in toddlers with autism. And the presence of many of these social impairments is central to the diagnosis of ASD. Okay, but yeah, and so as we said, they have difficulties in joint attention. They're less likely to imitate others, and the way they play is different. They are more solitary, and their play is less complex, less purposeful, less symbolic. Okay. And coming to language, yeah, this is what most of the parents notice and come up with. So 20 to 25% of children may remain nonverbal. Others may not be able to produce their first word until 18 months or older. And you will find that they show reduced babbling, complex vocalization, fewer single words. Okay. And when speech is present, it's mostly echolalic, and the receptive and pragmatic aspects of speech may be impaired, and they prefer listening to some mechanical signals than infant-directed speech. So this is repetitive behaviors or stimming. Stimming is a self-stimulatory behavior. Okay, it occurs, it often manifests as repetitive body movements, such as humming or hand movements. It's common among the autism spectrum. It provides, we also stim, okay, we also stim at times, even typically developing. It's because of, because it provides us comfort or enjoyment. Stimming actions can vary in intensity and the type. And autistic people of any age, they stim either in response to anxiety, stress, fear, or it may be because of some excitement also. They stim when they are feeling very overwhelmed, and this could be auditory, it could be tactile, they may be just doing skin rubbing or scratching, it could be visual, it could be vestibular, it could be olfactory. It is to satisfy any of these senses. Okay. So repetitive or unusual motor behaviors usually become apparent between 12 months to 3 years of age. Okay. So the other thing what we have to think of is regression, very, very important. Typically, the mother may feel that the child has been growing normally, but then suddenly has a setback, suddenly is not, communicating much back with her, or she suddenly stops speaking or is not uttering words, then this is a red flag sign. Okay, and so these are the red flag signs at 12 months, at 18 months, at 24 months, and at any age, poor eye contact, no response when name is called, developmental regression. And for now, how do you diagnose these autism? Okay, we have lots and lots of tests now that are available. We have the DSM criteria, we have the ADI interview, but what is the stability of diagnosis in the age group less than 2 years? Okay, most of these, in the studies, most of the time this age group has been underrepresented. Okay, so they have lot of limitations. Okay, so diagnosis before the age of 3 years may be more appropriately treated as only a provisional diagnosis. Okay, and so what do we do next? What can we can do a developmental screening. There are a lot of tests that are available. Okay, but why is it important? Is because early detection through screening methods helps in early diagnosis and early intervention programs, which improve the functional outcome. And so what should we do when we suspect this? Either we have to, refer the child to a comprehensive multidisciplinary team, which is now available in both private and public sectors. And a number of other conditions. You have a lot of autism mimics, intellectual disability, social communication disorder, developmental language. So there are a lot of tools available for screening. We have the MChat and the QChat. But what we normally follow is a MChat. It's about it is done in babies, children between 16 to 30 months. It's a 20-question test, quick, easy, where all the abnormal responses are scored 1. So a child is considered low risk if it is 0 to 2, medium risk 3 to 7, high risk if it is between 8 to 20. Okay, and if it is a low risk, then we can reassure them and screen them again if required. If it is a medium risk, we offer what is called the follow-up, MChat follow-up. And if it is a high risk, then we refer immediately to a higher center. Okay, and as a role of as a primary care provider or a primary pediatrician, okay, it just doesn't stop with early identification. We also have to look after their routine health maintenance, preventive care, care coordination, provision of support, guidance and advocacy. Okay, and it's our job to also identify the comorbidities that can exist with autism, like medical, behavioral, genetic problems, and because treatment of these comorbidities will, improve the function. Okay, so we have to. This is our job to do. Okay, and so basically, this is the spikes is a format with which we approach a parent. We just don't tell them we feel your child is autistic. We look at the setting, we look at the family's perception, we invite them to seek information, then we share the knowledge, show empathy, and then the summary. Okay? Yeah, these are some questions which I think we can discuss in the question hour. Mrs. X says that my child turns to me when I call her and looks at my face. Okay, I'm not sure whether it is eye contact or not. Okay, because these are the common questions that we see. Okay, yeah. Okay, so we can discuss these questions in the question and answer session. Okay, thank you.
Thanks, Dr. Meenakshi, for that excellent lecture. You clearly highlighted the importance of early identification of autistic spectrum disorder, and you also highlighted the importance of MCHAT-R actually, which every pediatrician should follow in his office practice. Because if you are going to identify ASD at an early phase, you are going to do wonders in the life of these children.